So the medication-assisted treatment program that we offer at InterCommunity, which is tailored to actually reduce the amount of opiate utilized in the community or eliminate it altogether, is very special. We do holistic care, which means that when the client come to us, not only are they accessing the medication-assisted treatment program, but we also assess for other medical conditions with our primary care clinic, as well as behavioral health concerns that the client might have. The clients that we receive have not been consistently taking care of their health needs due to their substance use. So the idea is to be able to measure where they are within their health during that first visit and offer the client the services that they're seeking for. And this is very patient-centered, which means that at times, because we're able to see them on the same day for medical services, psychiatric services, and behavioral health, the number of visits that they have to come to our clinic are less. Where in other systems, they might have to come multiple times to meet with different providers. Transportation then becomes less of an issue because now you're making just the one trip or less trips, obviously, into the agency. Our behavioral health clinicians are very diverse, from Latino clinics that speak Spanish to Anglos and African Americans. So we have a gamut of clinicians that are very much embedded into our system to offer those services for our clientele.
I'm a provider of what we call medication-assisted treatment, or medications for opioids or for alcohol. And they're medications that help reduce the cravings, or they lessen the desire for people to use substances. So it makes it easier for people to quit using drugs. A lot of programs historically, and even today, are focused on just the addiction. Let's just give medication just for the addiction, focus on the addiction, and then leave everything else out of it. So the prime reason that a lot of people got addicted to opioids in the first place was they have some underlying pain problem. So they started on opioids, and that developed into other opioid problems. And so if you don't address those physical problems, it's not going to go away. If a lot of other people use because they have mental health issues, they're sad, they're depressed, they're bipolar, they're not doing well, and their way of coping is through using substances. And so if we're not addressing that piece, then they're not going to succeed either. And if you try to do it without medications, like I've said, it tends to not have as good of outcomes. So you kind of need all three. We offer the traditional Suboxone, which is a strip that they put in their mouth. We offer injectable products that are similar to Suboxone that they get once every 4 weeks, so they don't have to deal with taking the medication every day. And we offer non-opioid options for opioid addiction, like naltrexone. And even besides opioids, we also treat alcohol addictions, cocaine, any substance use issues.
So we see both. We see people family members bringing their loved ones to seek support, but we also see a majority of clients just walking in on their own. And what I would say is not to be intimidated by our environment. It's a very friendly environment, very welcoming. Everything is done very privately, so there's a lot of confidentiality when we're treating you. And you might see a friendly face because a lot of our providers and caretakers are actually living in the community. So you might see somebody that you might know that makes you even feel more welcome into our agency.